Merry Christmas, you filthy animals. Welcome back to A Potent Dose of 3. My name is Jasmine.
I'm Kathy.
Ho, ho, ho. This is Linda.
You had that up your sleeve for a minute, huh?
Yeah. No, that's what that just popped in my head. And we're bringing you your weekly dose.
And this is part 2 from last week's episode. Let's get into it.
Let's go. I'm honestly even learning to work with like dementia patients too. Like that was very interesting because I had a patient who had dementia, and a little quick funny story. Had dementia, and he kept telling me his wife left him for a younger man. And I'm over here, and I'm an empath, okay?
So you're feeling bad.
So no. So he kept repeating that line over and over and over and over and over, like nonstop the whole ride, nonstop. And I'm like, at first I was like, man, how could she leave it? And I knew it in my heart that I knew he had dementia, but still I'm like, I really hope she didn't leave him.
Yeah.
Sure enough, we walk into his house and she's sitting right there, and I'm looking at him like, you lied to me.
I'm like, so is this the woman you said left you for a younger man? Huh.
But the funny thing is, I knew he had dementia, but I was like, it's either real or it's not. But
yeah,
but the way he was expressing it with so much sadness.
Oh, I would have felt bad.
I felt so bad.
He made it seem like it was real, but
yeah.
But it was real for him too. Like he didn't say it was real, so I would have felt bad.
Yeah, and I was over here trying to give him I was like, it's okay, you're independent.
Yeah. If you're independent.
I even started singing
E-N-T, do you know what that means?
But yes, honestly, you learn a lot on the job. You make mistakes. You learn not to do something the next time. You learn to be quick on your feet for sure.
Oh, I bet.
Yeah.
So I remember when you started working there, you say that you were very, very nervous. And now, how do you feel about the job?
I would say I'm definitely not as nervous. There are times where obviously I'm gonna get nervous, but I think I've kind of shifted my mindset in the sense where instead of being nervous and anxious about things, it's more I want to be prepared. And so it's just a different mindset. I don't know how to explain it, but before it was fear. And right now it's more nervous, but with confidence, if that makes sense. Confidence to be okay, well, this is what could go wrong and this is how we would handle that.
Yes.
Instead of, oh my God, what am I going to do? What if this happens? What if this happens? It's kind of I have solutions or things in the back of my head where I'm okay, this is what we're going to do.
Yeah, so I just do that critical thinking behind it.
Yeah. So I just feel I feel more confident in my role. Even when the thing with working as an EMT is you're not going to get the same patient. You always get something different. So everything is different. So it's kind of in a sense, I think, also preparing me to work in medicine, because it's things are not going to happen the way you plan them to happen. And I think that's the good thing the thing that I'm learning as an EMT is I have to be prepared to not be prepared.
Yep.
But with that comes not being nervous and being kind of more confident. Mm-hmm. So
that makes a lot of sense. You just having to be more, not flexible. I'm not
flexible.
Yeah. There's another word I want to use for flexible, but basically you're learning how to adapt to any situation that's brought your way, which is very good. Yeah. And many people struggle with that. And I feel for me, I'm learning to make that shift of with the mind, telling my more positive affirmations and stuff, just that mind shift of not letting my anxiety get the best of me. Take it as a learning experience. Yeah. I'm nervous, but more so I'm nervous what I'm going to do next. Yeah. And being able to kind of basically what you said.
And I'm not going to lie, I'm not trying to tell the listeners I'm super confident. I'm not. But I think I've gotten to a point where yesterday I had a patient and the oxygen level dropped and I did get nervous. I did get nervous, and my first instinct was to increase the oxygen saturation. But I was okay, just chill. You did what you had to do. You learned that what you were thinking was the appropriate action and you did it. And it just kind of it just taught me give yourself grace. It's okay. Everything you go through is a learning experience, and I think I'm just every day that I work, I'm getting more confident with not knowing something because it's...
And that's okay.
Yeah, because it's something that I'm gonna learn.
Yeah. And you're there to learn in a sense.
Yeah.
So how has it been? Because I know, like Kathy said, like the beginning, you were kind of anxious. And now it sounds like you feel a little bit more comfortable. But how has it been working with your partner, like your EMT partner? Have you ever felt that, like, I don't want to say like inferior to them, because I know you like mentioned in the past that just like they know more than you, you may not feel like you knew as much. How do you feel about that now?
I personally really like working with someone that has more experience than me. I seek that. I want that, because if I'm with someone who doesn't have as much experience, I'm perfectly capable of like taking the lead, and I'm okay with that. Like I've experienced that, on my shifts already. And it's fine, but it doesn't challenge me the way I want it to. Like when I work with a partner who has more experience than me, I always tell them like, hey, especially if they don't know me, like I'm pretty much a baby EMT,
the baby nurse and the baby EMT.
Yeah, I'm like, I'm pretty much a baby EMT. And like, if I find out they have more experience, I'm like, I am totally okay with you, telling me to do something a different way, or explaining, to me why, another route might be better or something. And so I'm okay with, you giving me criticism, like, or teaching me how to do something, because I mean, that's the only way I'm going to learn, to be honest.
Yep.
Well, that and making mistakes. But yeah, so I really like actually working with someone who has more experience. And I feel like before I would have been really nervous, like you said, but I think now I'm taking it more as, no, like they're going to teach you something. Although it does matter the way they teach you, because if they're not nice about it, then that might be a little intimidating.
Yeah, that is true. And you may not be so much like receptive of the information if they're intimidating or seem like they don't want to teach you anything.
Right. But I've been really lucky. All my EMT partners have been really nice to me about like the way they teach me stuff and things like that.
You get to learn and grow.
Yes.
Yeah.
And like aside from like work-wise, you surrounding yourself by people that know more in life in general is a great way for you to grow as a person.
Yeah.
Like even with like friends group, like you should not be the smartest person in the room or anything. Like everyone should be feeding off of each other and contributing in some way. You don't want to be around a bunch of dummies, because then that starts rubbing off on you, because it's good to surround yourself by smart people that you can learn from.
Definitely personally and professionally, I'm open to expanding, the people that I have around me, because I like we said in the previous episodes, like I want to develop as a person.
Same.
Not only professionally but personally.
Yeah.
So if that means me breaking out of my comfort zone, I'm willing to do it.
Ooh, that comfort zone. Like it's uncomfortable in the beginning, but when you keep exposing yourself, it do become comfortable over time.
And honestly, that's something that I'm learning too with my EMT job, is because I am with my partner for 12 hours. Okay. And
that's a lot.
Yeah. And so I've fortunately had the same partner for a while now, because I pick up with her. Shout out Kelly. And we're doing a shift bid now, meaning she's going to get a new partner. I'm going to get a new partner. And I thought about it. I'm like, damn, girl, who's going to be your partner?
Wait, why are you guys doing that?
It's just the way the job works. So like every few months they do a shift bid, so you can change your shifts. But she's because she has more seniority.
Okay.
She's gonna get her shift bid first. And I have least seniority because I'm part-time and I'm an EMT, so paramedics get,
Oh, that makes sense.
So
that's
anyway,
kind of like in healthcare in general, even with the rookie nurses.
Yeah.
It's like you get the terrible schedule and the seniorities.
Yeah. So I'm gonna have to get a new partner, and like obviously I'm sad about it, but then I was talking actually with this, I think with Kelly about this yesterday, and it's like, okay, well, being around a new partner, they might be able to teach me something different. You know what I mean? And so I'm just, that's the mindset I'm trying to have, instead of, I gotta work with a new partner. What if I don't like them? Like, I'm throwing that all out the window.
Get that out the window.
And I'm just
throw it.
going with the flow at this point.
Yes, throw it out. Yeah, go with the flow.
Just welcome the growth. That's
really?
it.
Yes.
Really.
Welcome the growth.
Watering my soil.
Water.
Fertilizing it.
I guess so. For me, another update that I would give is I had an OSCE. And I know I was telling you guys about it, Jasmine and Kathy. I haven't told the listeners about it yet. But basically, I had a midterm OSCE and I had a final OSCE. And
What's an OSCE?
What an OSCE is basically, I don't know what it stands for.
Objective Structured Clinical Exam.
Oh, thank you. Thank you. You'll be doing OSCEs too, everybody. You, Kathy, and Jasmine.
Yeah.
So
I saw it on the med school curriculum.
Yeah. So the OSCEs is basically, it's testing our knowledge as a provider. So we have patient actors, like live people, and they'll come in to the clinic, emphasize our, what is this called? Air quotes clinic, with a problem. And as a provider, I have to interview the patient, get the HPI to understand what's going on so I can give a diagnosis and also do a physical examination. So with this OSCE, it was my final one. I knew it was very important. I practiced my butt off day and night. Like I met up with my 3 classmate friends. Shout out Sam, Alea, and Heidi. Like we practiced our butt off preparing for the final OSCE. We did the whole head to toe. We did the patient interview and everything. And I was in a sense more comfortable and confident with doing the final OSCE when it was time to do it. So the day of the final, I go in with the provider that I was in my head, the full confidence. Like, Linda, you got this.
I'm a bad bee.
You the HBIC. Y'all know what that means? That was me. So the simulation starts. I will walk in, introduce myself, get the patient's identifiers, blah, blah, blah. Starting the simulation, the TA comes in, says, pause. Something's wrong with the audio. We cannot hear you on the other side. Great. In my head, I was like, great. I'm already anxious in a sense. And now I'm being stopped saying, that they can't hear me. I have to wait until they fix the problem. So I'm sitting there already super awkward with the patient. I'm looking at the patient looking at me. I'm looking at the patient looking at me. I'm like, hi. Like it was uncomfortable just sitting there.
Okay.
Yeah, I was uncomfortable. So that threw me off. And then so they said, continue. So I got the patient history or whatever. And then as I was going to start my physical examination, I stood up and I said, I'm going to palpate your head. She came in for a headache. So I'm like, I'm going to palpate your head. And I reached for her head. She moved back. Like she was like surprised and didn't want me to touch her. She moved back. And I was like, oh, I'm sorry. That's what I said. Oh, I'm sorry. I'm just going to, palpate your head. She's like, what's palpate? And I'm like, dang, Linda, that's already 101 what they teach you. You don't speak medical terminology with patients. You do layman terms. Yeah. So I was like, I'm sorry. Palpate is I'm just going to feel around your head. Let me know if you feel any tenderness. I'm searching or feeling for lumps, anything abnormal. So she says, okay. So in my head, that already threw me off because I'm like, dang. So then I move on to assess her cranial nerves. And cranial nerves, I told her, so I explained myself because she was surprised with the other thing. So I told her, I'm going to assess your cranial nerves. I'm going to have you stick out your tongue, puff out your cheeks, look up, look down, frown. And then I'm also going to check your mucous membranes. That means look into your mouth, look into your nose. And I said, can you put down your mask so I can do this? She looks at me and says, everything's fine. That threw me off again because I'm there to do a physical examination and she's not letting me do the examination.
Linda's like, how would I know? I didn't get to see.
Yeah. So I was confused. In my head, I was like, why isn't she letting me, examine her when this is a part of what I'm supposed to do? So she said, everything's fine. I was like, oh, okay. And then so I look at my notes because I was going to move on. And as I was reading my notes, she says, so what's my diagnosis? And I said, your diagnosis is you have migraines, da 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 da. So I just gave her the diagnosis because I feel like she was rushing me. Mm-hmm. And I felt like she didn't want me to touch her. This is now I'm all in my head. Yeah. I was like, she didn't want me to touch her. She moved back. I asked to assess her cranial nerve. She didn't want me to assess that. And now she's rushing me, asking me to do a diagnosis.
And once you go into your head, it's over.
It's over.
Like,
I'm deep in my head at this point. I was like, at this point, I was just so thrown off because I took it as I was confused in that situation because I was like, is she speaking as a patient or is she speaking as like a professor? I didn't know her role. I didn't know where they found her at, but I took it more as she's speaking as a professor, someone of more authority. Because in my head, I was like, why is she kind of, in a sense, rushing me? I didn't have this experience during midterms. This is like a different experience now with her. So I'm like, okay, there's she maybe knows something I don't know. Right. So there was in a simulation. The TA comes in to evaluate me. And she said, well, you did good with the history taken portion, but during the physical examination, you didn't do this. You didn't do that. You said you're going to assess their cranial nerve, but you didn't assess their cranial nerve. You said you're going to do that, but you didn't do it. So I was just hearing like negative of like...
You were just getting punched.
Yeah.
Left to right. While the patient was still in the room.
Yeah. Ugh. Which is weird.
Yes, very weird. She was like telling me all this. And so the TA kept saying like, oh, you should have done this. You should have done that. In my head, I knew I should have done it, but I didn't do it because I was thrown off. I was so thrown off of how the patient was reacting to me. And then so I told the TA why the patient was in the room. I said, I was confused. I wanted to assess these things, and the patient literally just said everything is normal. And that threw me off. And then while I was talking and when I was hearing all of this, I felt myself getting like emotional. Like I wanted to cry in there, but I told myself to keep it together.
Yeah.
Cry when I leave out the room. Like, don't show my emotions in this room. Stick it together. Keep it together. And when I get into the car, I can just cry and let it all out.
Yeah. With your blacked out windows.
For real. So I was able to hold it together. And then I left the room and I was like, Linda, just get your stuff, go to your car. And the TA said, Linda, like, good job. Like, she wanted me to talk to her. She wanted to talk to me, but I didn't want to because I felt myself crying. And I looked at her. My eyes was already like watering up. And she was like, what's wrong? Like, talk to me. And I was like, no, I don't want to. So I'm like, I walked away. Like, I was just going to walk to leave because I didn't want to cry in front of them or there. She was like, no, don't walk away from me. And I stopped because I know turning my back to people while they're talking, that's rude. And I didn't want to be rude. And that I best believe I wanted to leave.
Yeah. You're like, should I be rude or crybaby? Rude.
Which one? Rude or crybaby? Which one? So I turned back around and I talked to her. And then now another professor is in the room. And I'm crying, telling her what happened. I was like, I feel like the patient just didn't want me to touch her. I tried to do this. She didn't let me. And then as I'm saying all this, the patient walks in. So it's even more awkward at this point. And then so they grabbed me. They said, oh, let's go into the other room. Took me to the other room. I explained everything that happened. And the professor said, that was not a part of the simulation. That was not a part of your OSCE. But even though it didn't go the way you had planned in your head, that was a great learning experience. She said that, I'm not going to always have patients that cooperates. How do you say that word? Cooperate. Yeah. So that was a great learning situation for me in the future when I'm become a provider, because I should never give a diagnosis without doing a thorough assessment. Because a patient can easily come back and kind of come for my license and say, well, you said that I had X, Y, and Z. And for evidence, it's going to be like, what did you do? How did you rule that out? What physical assessment did you do to say that patient had like that disease? In my head, I knew all of this. I knew that, but I was just thrown off. I'm like, I'm being tested. Why is this all this real life stuff coming within my simulation? Mind you, the patient's phone was vibrating and everything.
You're like, this is real.
Yeah.
I was not ready for it at all. So she was just giving me feedback because she said, good thing that this happened here in this setting in school, because I'm a student. I'm learning. I'm supposed to make mistakes. Because when I make mistakes, that's the way I learn. At least I'm not a provider with my license making these mistakes in real life, and then I'll be screwed in a sense.
Yeah, when you make mistakes, it's for sure going to stick in your head. Like, this happened before I made this mistake. It's not going to happen to me again. So yeah, you made the mistake, but it's just making you a better provider for the future when you do have your license, and that way your license is not going to be in the line because you work so hard to get it. No.
Yes, I agree. And now that I made that mistakes, I'll remember. Now it's stuck in this ingrained in my head. Don't do that. Don't never ever 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 do it again.
Hey, making mistakes helps sometimes.
For real, it definitely makes a difference. And so her talk did help me feel better during that moment because I was like, dang, I was beating myself up. But she made a point. I'm learning. I'm not going to know everything.
Yeah. And I'm glad she said it like that, you know?
Same. They're so sweet.
Yeah.
I can't wait. I can't wait till you meet the fall semester
me neither.
professors.
Sorry. The one thing I'm learning to or picked up on is like your mistake again, Kathy gets to learn from you.
So you'll know.
Thank you, Linda. She took the punch.
Yeah, so they cheered me up during that moment, but I was still kind of like
a little upset.
I was upset, still felt a little defeated. And then so I get to my car and I call my classmates to see if they had a similar experience. So I talked to one of my friends, and she said, no, like I didn't have that experience. And I told her, how I asked the patient to put down her mask. She was like, what? Not, she said before they started the simulation, the TAs told them that because it's COVID, the patient is not required to pull down their mask. Just verbalize what you're going to say. So in my head, I was like, damn, like I jumped to conclusions because I swear to you guys, I don't know where I was, but I did not hear the TA tell me because of COVID, the patient is not required to put down their mask. So now I start thinking maybe the patient was reacting that way because I was asking her to take down her mask.
Maybe they were confused.
And I got confused why she didn't want to put down her mask.
I was confused. She was confused. We
They're
were all confused.
Yeah.
Yeah. So then I start feeling bad because in my head, I made a small situation way larger than what it should have been because of that missing piece of information. So if I would have known that, I already knew, not to.
And it wouldn't have thrown you off.
It wouldn't have thrown me off. I wouldn't have been crying in front of the professors. So I started feeling bad and I started feeling like, dang, I just made a sense of fool of myself because it wasn't that after reflecting and after sitting in it, it wasn't that much of a big deal. But there I go. My emotions blew it all up. And then that night, the TA texts me. And mind you, this is at 9 p.m. The TA texts me, I'm just checking in, making sure you're okay. I know tonight was a lot. I just want to make sure you're doing okay. I'm like, I'm doing okay. The next day, open my email. Professor, hey, Linda, you've been on my mind lately. I just wanted to reach out to make sure you're okay. I'm here to provide emotional support, any type of support that you need. I was like, just leave me alone at this point. And then a few days later, another professor that wasn't there sent an email, CC'd all the other people.
The CEO, the president,
she was making sure if no one knows, now everybody knows.
Saying, Linda, I heard what happened. I'm sorry I didn't reach out sooner, but I'm just checking in to provide some support. I'm going to look at your video so I can see what happened. I was like, no, because at this point I reflected and I realized I could have handled that situation way differently. Yeah. I do feel like my emotions in a sense, like, got the best of me.
Right.
Granted, I was mentally preparing myself to get to the car and break down.
Yeah. No.
They didn't let you get there.
I held it together with the patient.
And Linda's like, I tried, man.
I tried my best. I was fighting for my life. So I love the fact that they were so concerned. The professors were so concerned in making sure I was okay and making sure that just reassuring me and saying that, even I didn't want this to happen, but they said they're going to look at everything so I can redo the physical examination if I need to.
Yeah, knowing Linda, she hates attention. So she's like, damn, I'm getting all this attention. I just want it to be over with.
And that's what I told them. I tried my best. I sent a nice email saying, I really appreciate your concern, but after doing some self-reflection, and looking back at the situation, I have come to find out that my emotions didn't equivalate to what was actually happening during that situation. So can we please move forward from the situation? I had learned my lessons, and I would, I know what to do in the future.
Yeah,
Right.
yeah.
That professor said, thank you for that, but I'm still going to look at your video. So I was like, okay, great. So then, mind you, my final OSCE was mid-November and November. That was the end of November. This is still going on. This recently, she sent the email on this past Friday saying, hey, Linda, let's hop on Zoom so we can figure out how to move forward. I want to give you the fair opportunity like other students. I'm like, I don't want no fair opportunity. Like, no.
I feel like Linda was like, move forward. I've been moved forward.
Yeah,
what do you mean?
That's what I said. I'm trying to move forward. Y'all keep bringing me back.
Linda's just trying to hide underneath a blanket.
Same. They keep
trying to
pulling me. I love the fact that they care so much, but I was like, it's okay. I kept telling them it's okay. So I hop on Zoom with her this past Friday. So tell me what happened. And I tell her, and it's crazy because even when I was telling her, I felt myself getting emotional again.
Yeah.
Like I didn't like break down, but I did feel myself getting emotional.
Therapy.
So I told her, and then she said, I didn't get to look at the full video. I just been so busy with a lot of things. But the snippet the small part that she did see, she said she saw how the patient was kind of like acting and like, the patient was basically sometimes asking things that she should have waited to ask. Like she was just not playing her role the way she was supposed to play her role.
And in a sense, throwing you off.
It was, yes.
As a provider, as a student.
Trying to be tested on the stuff I need to practice on.
So the patient needs to go back to acting school.
Yeah, the practice, no, it's Kathy.
Oh, Kathy.
I didn't say all that.
Oh, Kathy.
Maybe the patient just was sick and tired. She was tired. She wanted her food. She already had 3 other students practice on her.
I guess.
So she said, she's going to look at the whole video and she's going to talk to the other professor and they're going to plan a day she wanted me to redo it that same day. But I was like, no, ma'am, I don't have time. I got to figure
That would have
this out.
been really unfair, I think.
Yeah. But she was like, in her head, she probably was thinking, I practiced everything I should know how to do this stuff.
Yeah. That's true.
But I was like, that's went out the window after the.
But that's literally like everything. Like you practice and then boom, out.
No.
Yeah.
I have other life. And so she said that she wanted me to retest on Monday because I said Friday, that same day was not going to work. So she's like, oh, okay, Monday at 3, me and the other professor will get together and we'll assess you during like the physical examination. Because you already got, that was binaural. Because you got neural already, you won't be tested on that. You'll be tested on something else, some other type of body system or whatever. I was like, great. So now I got to go back and study all this other stuff that I forgot in a sense, and it gives me more anxiety.
Yeah, now you're like 2 days before, like you have shorter period of time to like get ready. No.
Damn.
No, I would be stressing. 2 days.
So I was super anxious. So in my head, I was like, dang, now I have to review everything. I have to study. And now I'm really put on the spot because I now have 2 professors looking at me to do the examination. Before, it's like, it's whoever behind the door, behind watching. So I told her before she hung up, or before we got off with Zoom, I said, when you do look at the video, can you provide me feedback? Like, you can call me, you can text me, but I would love to know whatever feedback you give me so I can practice that so Monday I can be ready.
Yeah.
So that same day, Friday, I was going to watch the Lion King musical. She texts me. It was around 6:30 p.m. She said, I'm sorry, it's lunchtime, but I have some really good news for you. Are you able to talk on the phone? I was like, good news? Yeah, I can talk on the phone. So she calls me and says basically that she and other professor watched my video and I did very well. She said, she saw that I knew what I was doing. The physical examinations that I did do, like I knew what I was doing. And good thing that I verbalized what I wanted to do. That showed again that I knew what I was doing. Yeah. She said again that she noticed that the patient, in the future, they'll train that patient actor to to play their role a little better.
Kathy wasn't wrong. No.
Yeah. So they'll let them know so like the students can do what they're supposed to do and not be like thrown off like that. But she said, everything is good. I can relax. It looked like I knew what I was doing. And honestly, that was very good to hear because I was like beating myself up in a sense, thinking like I was in a sense incompetent of
you still somehow found a way to blame yourself.
Yeah. Even the situation, even though I did feel that way in the room with the patient, I still changed it all up. Like because I said, oh man, I started to feel bad for the patient. Like, oh, Linda, you're over exaggerating. You da. It was more you, not the patient. And to hear her say that she watched the video and she saw what I was saying, even then I was still able to
like validate your feelings. Yeah.
So that was my life. I've been stressing, but I'm done with the final OSCE.
Awesome. That's great. And honestly, you took a big learning experience because anything like that ever happens again, you will know how to.
I would know how to handle it.
Yeah.
And also, I'm sure you learn how to give yourself some grace because sometimes you're so hard on yourself. Because I'm so hard on myself as well. And it's just, it's a learning experience. This is not the real stuff yet. So it's okay. You learn and you grow.
Like she said, better to make them now than later.
Yeah.
Yeah. And that's honestly what I have to tell myself because I beat myself up so much about wanting to be perfect, knowing dang on well that I am not perfect. So in my head, I'm working on not trying to fulfill that perfection role in a sense when I know I'm a student. I've never done this stuff before, so it's not going to be perfect.
Right. Right.
And I feel like once I understand that, like actually believe it, hopefully that's when I'll feel like get less upset or less triggered about certain things that will come up because it's not going to be the last time they'll give me like negative feedback. It's like, I'm supposed to get in a sense negative feedback because I'm learning.
Yeah.
Right.
So that was me.
So, Linda, I know we were talking off the mics before, but you told me something about project preparation.
Oh, Project Prepare.
Yes. How was that? You just told me the name, but we didn't go into details.
So Project Prepare is an amazing organization. So I never heard of Project Prepare either until this semester. Like during the whole semester, the professors kept saying like, oh, we have to figure out 2 days where you guys can train with Project Prepare. You're like, oh, Project Prepare. And they're like, yeah, they'll come in and teach you how to do a urogenital exam, prostate exam, pap smear, pelvic exam, breast exam. So the whole time, me as a student and everybody else, we were thinking, oh, they're just going to come in, talk about it, and then we're going to perform this stuff on mannequins. Surprise, surprise, surprise. We were doing the physical exams on actual people.
That's crazy, huh?
People that volunteered their body for us to do like a pap smear, a prostate exam.
Yeah.
So it was a great experience in the sense that I was able to, of course, practice on human people. Like it's a different from doing it on a mannequin and an actual patient. Like it was in the beginning, in a sense, a little bit uncomfortable because, we're all there like in their kind of like their private settings and like in a sense like intimate in a way where like I'm able to see everything, but as a provider that's what I'm going to be doing.
Right. Yeah.
So having the opportunity to practice on someone before I get into practice, it was a great experience.
Yeah, because imagine just practicing on mannequins and then being like, okay, now I have to actually provide for someone in person. Like I think the transition from that to that would have been not as smooth.
Nope. Nope. Not at all.
Yeah, and with these procedures, which are so intimate, like you said, a mannequin won't tell you like, oh, it hurts. Like, and then you might be thinking, oh, I'm doing it properly, in a mannequin. But with a real person, they'll be able to give you feedback and saying like, I feel a bit uncomfortable here. Try it this way. Like, you get to see the real thing.
Very different.
I get to see the real stuff. The mannequin's not going to have the whole body structure that a human would have. Yeah. And the whole time in my head, I was like, what made y'all think to do this? Because this takes a brave soul to just be that vulnerable and letting students like practice on them.
Yeah. Oh, yeah.
I was like, that's a lot. But they were so nice and so knowledgeable. And then aside from them teaching us how to give the examination, they also taught us proper terminology to use when talking to patients. So, for example, when giving a pap smear, not a pap smear, what is it called? Prostate exam. Mm-hmm. The Project Prepare guy said to never tell the patient, bend over on the bed so I can check your prostate. The proper way to say it is lean on the table, and I'll check so I can assess your prostate or something.
And that makes a big difference if you think about it, like those two statements.
Yeah,
very different.
Bend over versus lean over. And then same with like, you don't say I'm gonna push in my finger. You're gonna say I'm gonna insert my finger or insert my digit, because like you said, the way you say things matter.
It can make you feel really uncomfortable.
Yeah. It makes a big difference. So I feel like I just learned so much that whole day. And even with the breast examination, the lady said, not everyone referred to their breast as breast, because it can sometimes have like a gender word or gender.
It's not
gender
to
neutral.
It.
Yeah. So with breast, instead of saying, I'm going to examine your breast, you say I'm going to examine your breast tissue or chest tissue. And you never say I'm going to feel your breast. I'm going to examine your breast or palpate your breast. You don't want to say feel or touch.
And that's really good, because I know we talked about this in a previous episode, but although we do our best to try to respect, like different people that are different from us, we also don't know a lot. And so just teaching you that, I mean, I would feel a lot more comfortable, providing care for someone who, might be transgender, who just identifies differently than me, So I can see that being super beneficial.
It was honestly beneficial because I feel like I struggle with using gender neutral pronouns. So even then, one of the instructors from Project Prepare, she was saying, if you don't ask the patient, which their pronouns, don't assume that they go by she, him, or whatever. Just refer to them as a patient. So one of the questions that we had to read, I read, and we had to talk about it, why it was important. The question was, ask the patient about their last menstrual cycle. And I kept saying the reason why it's important is because maybe she has maybe that patient. No, I said she. Kept saying she and her. I said maybe she has irregular periods. So I had to stop myself instead of saying she, refer to that patient, that person as a patient. So because then it's not no gender attached to it.
Right.
So all of that was definitely a learning experience.
Yeah.
Let me tell you about pap smears. I give her props. That lady who let us
they're so uncomfortable.
They are.
Yes. And she had 5 people. It was 5 students working on doing pap smears on her.
Brave.
And it wasn't even just a pap smear. It was a whole pelvic exam. So we started with the pelvic exam. And what that entails is we literally had to insert 2 fingers. Yes. Each of us doing it, insert 2 fingers, rotating it, tapping on her uterus and everything, touching the cervix for 5 different people. And the whole time she was calm, very saying you guys are not hurting me. This is not uncomfortable for me. I was like, you know what? You deserve all the money in the world.
Yeah.
That's a lot.
Yeah.
Even with just one person, it's not pap smears are not fun. They're so uncomfortable.
And it was 5 students that did not know what they were doing in a sense. Yeah. That was our first time giving a pap smear. But the fact that they volunteered their body in order to teach us, in order for us to learn, that was great.
Hey, that's literally how you learn. You need to learn how to do it, and if it's not doing it correctly at first, that's just the way it is. And I'm glad she was really nice about it. Yeah. And I'm glad there's people like that who are willing to do that.
Yeah. And I wish that I was able to get the experience throughout nursing school, because I feel like it's better to practice on human people instead of mannequins.
Yeah.
Because that's how you learn.
Yeah.
So if there's listeners out there, if your program, you could be a med school, a nursing school, any type of where you have to deal with patient contact, request Project Prepare, because you'll be able to actually practice on human people.
Yeah. And it was just not just practicing in real people instead of mannequins, but also the language thing. That's very important, because even for when you start as a nurse, you have to also watch what you say, how you say it, how you record everything, because I feel like every time your license is on the line.
Oh, yeah.
It is.
So, and also for the patients to feel comfortable, because what happened if you wouldn't go into this project, like through this training?
You would have never known that what you were doing was making the patient feel uncomfortable.
Yeah, or was hurting the patient, like their feelings, like how how are you not gonna assume that I'm a she? What happened, And they'll be like, oh, change my provider to somebody else,
Yep, and there,
So it sounds like a great experience. I am looking forward.
It was an amazing experience. It was so amazing. I recommend 10 out of 10 to everybody. Search Project Prepare. If you want to volunteer your body, look at Project Prepare. I don't know how that works.
If you want to do it, props to you.
Go Glen Coco. But it was a great learning experience. And this semester has been a roller coaster, but then again, very good experience. Learned a lot this semester.
Yeah, guys, so thank you for listening. This is it for today.
And don't forget to follow us on IG, Facebook, TikTok, and YouTube.
At A Potent Dose of 3. See y'all next week.
Bye.